Oh, I dislike the upward arch,
Uh-huh.
and yeah, maybe the colour is a little bit darkish. So I'd like to have that all improved. I want, to be proud of my teeth and not sort of keep my mouth closed all the time.
Yeah, gorgeous. This particular patient that you will see on the screen has presented by referral from a general practitioner for a specialist evaluation. And one of the biggest concerns we had for this patient was the fact that she feels that her smile is worn. Although she's very energetic at this stage in her life, and she's very youthful looking, but she felt that it's just having a bit of a tooth wear, not just a bit, quite a bit actually, that's starting to affect her, the way she looks at life in the mirror, putting a lipstick on and smiling. She just feels that when she smiles, she doesn't show any teeth. And therefore, we felt that in order to help the patient, we need to maintain the number of things we have to do besides this. The most important thing whenever we do this sort of restoration procedures is to maintain biology. In other words, maintaining her own existing teeth, minimal or zero tooth intervention. We presented now in this next slide with a diagnostic mock-up, which I place in the mouth. I directly sculpt the composites in the mouth. And what happens is that I'm able to understand the patient's facial proportions, the whole geometry, and how the whole light reflects on the patient's face. Now, this is not taught in textbooks. You just have to have the experience and expertise to understand this. So when I reproduce a smile that I feel that fits to the patient's face, it's made for that particular patient. And in this diagnostic mock-up, you can see how the new smile line and the level of tooth exposure and the shape and the shade of the teeth and following the arch form restoration that complements the patient's dentofacial aesthetics. And that is aesthetics. So when we do this for our patients, we allow the patient to view themselves, and they sincerely, in many ways, they feel so happy and comfortable with the whole new smile line because it does balance the face.
Oh, I haven't seen it. I'm a bit worried. Oh, wow.
What do you think?
Yeah. Magic, eh?
Yeah.
Did you expect this today?
No.
You happy?
Yeah, extremely, yeah.
Okay, we can do this in composite. We can do. You like the color?
Yeah.
You happy? Would you like it whiter?
No. It's a good difference.
This is like 5-10%. You know, a lot better.
Ooh, you so transform your whole face.
Now, when you do your makeup, for instance, you do your makeup to highlight the best parts of your face and try to disguise not the best parts of the face. That is to create symmetry and harmony and a balance, the way our eyes, that are the windows of the brain, can see nature. And nature likes harmony. My work as a specialist reconstructive dental surgeon is to restore harmony of your face using dentistry. In the next slide, you can see how we have restored the harmony of this patient using dentistry. We've complemented the patient's dentofacial aesthetics in both static and dynamic format. Now, what do I mean by this? You don't walk around smiling all the time. You talk and you function, and you move, your head moves, and all the different angles. So when I'm taking videos of you, I'm looking at all the different positions that you express yourself. And we call it speech and smile dynamics, because the way we are in the real life is dynamic expression. And my work, my responsibility to you is to be able to help you achieve that symmetry, harmony, and not just simply you're looking in the mirror face on, but also on different positions when you're off guard and people can't see you, but we're going to make sure that it looks right in that position. Now here's the final images that's presented for this particular patient, and we're also very grateful that the patient has allowed me to present her case before and after for your education. And this is the reason, and the number of slides that we presented in this lecture is to help you understand the possibilities and the eventual outcome of what non-invasive reconstructive or aesthetic dentistry can do for you.
I was very pleased when Dr. Sarkar said to me, "You made my day." Well, I was thinking in the back of my head, but I had all these tubes in and things, that he made my life, because what a difference. Very quick. I mean, it was all done within, a few hours in the afternoon. So nervous about it that I thought I'll be the one failure in amongst the whole crowd.
Right.
I dreamt of it when I was this big, and oh God, why can't my parents have any
What did your
money?
husband say? What did he say?
Oh yeah, he said, "Listen, this is the choices. We could have had a magnificent antique cupboard in the lounge room, or we could have had this, except I prefer this."